Hello everyone. Assalamu alaikum. I am Nazmul Hassan Farhat. I am a medical laboratory technologist at Mother and Welfare Center in Bangladesh. I am a bachelor in science, molecular biology, and biochemistry. I'm also passed diploma in medical laboratory technologies. Today I have a special guest, Dr. Akram sir, founder of Academically in Australia. Hello sir. Assalamu alaikum.
Hi, Najman. Welcome. How are you?
I'm fine, sir. Uh, First of all, I want to know about yourself and what you motivate to start this organization.
Okay, so my name is Dr. Akram Ahmed. I'm basically a Indian pharmacist. I completed my diploma, bachelor's, master's, and PhD from University of Sydney in Australia. So basically, last 10 years, I'm a pharmacy lecturer. And so I make basically content on YouTube in last 5 years. And Dr. Akram Ahmed, I have a YouTube channel. So I always make videos there, so the people how they can migrate to Australia or some other countries like Gulf countries, US, UK, Canada, and all those countries. So that's some people always ask in comments at the where we have to go. Is there any coaching center to pass the exam, or is there any consultancy for us to can help to complete the process so we can easily migrate? So I was in my PhD. So once I completed my PhD, and I got a little bit more time. So academically, we recently started last year.
Oh, thank you, sir.
Yeah.
Can you tell us about your organization and what is does work?
So basically, academically it help. Basically, we complete A to Z process. So, for example, if you are a pharmacist or you are a lab technician or you are a nurse or medical doctor, now you are looking to migrate to Australia, for example. Okay, so there is some steps you need to complete. For example, like document evaluation. Then you need to pass the exam. We will help you to complete your this process, and will give you the 4 month coaching to pass this exam. Once you pass the exam, then you need to apply for visa. Then we will guide you regarding the visa and for jobs. So we basically help all the healthcare professionals if they want to migrate to Australia or any other country. So academically is helping them to complete all the process so easily they can migrate to that country. Slowly we are recreating some other country like we are doing for Gulf countries so long, but recently we are running the book country like Canada and UK as well. But in soon we are going to start for US as well.
What is the opportunity of Bangladeshi student or Bangladeshi professional in Australia, healthcare
Yes, we
professional?
have any basically I think 5 or 6 pharmacy students. They are from Bangladesh, so they are doing right now the Kaps exam preparation with us. Even one girl is she's living in Sydney, so I have interviewed her as well. So a lot of. So if you are basically did your pharmacy degree or laboratory technician degree, nursing degree, medical degree, so you can easily migrate from Bangladesh to Australia. So you just need to pass the exam, and we will help you to pass the exam. We'll give you the coaching around 2 to 4 months, and then you can pass this exam in your home country in Bangladesh itself. Once you pass the exam, then you can apply for your permanent visa to Australia. So you can migrate basically not just you, your family, your wife, if you are married, and your kids all together, you can migrate to Australia.
What are the regulation and law governing pharmacy practice in the country like Australia, New Zealand, Oman, Kuwait, Dubai?
Here the regulations are very, very strict. So we cannot compare with
Mm.
like Bangladesh or India or Pakistan, Nepal. In our countries, anyone like 10th or 12th pass, he can open his pharmacy, he can work as all those things. But here is very, very strict. Uh, Pharmacist is very the authority in Australia. Without his sign, you even cannot get a single medicine. So you have to get a prescription from a medical doctor and go to pharmacy, and then pharmacist will check the validity and he will give you the counseling. For example, how many times you need to take, when you need to take, what you need to take, the precautions, all those things. Then only he will dispense the medicine. So without I can say the pharmacist is very, very good conditions in Australia. It's not just the pharmacist, the other professions also, this is not like our country because it is a high income country in Australia. A lot of regulations here, and so they need to follow. So in terms not just the money, They have a very good reputation here. And
Another
pharmacists can work in retail pharmacy. They can work in hospital, like clinical pharmacists, hospital pharmacists, consultant pharmacists. So there's several positions is there. But initially, any migrant is coming. For example, any Bangladeshi pharmacist did like master degree, bachelor degree, master degree, or PhD. Now they want to migrate to Australia. So they have to go with the same process. They have to pass the exam. They move to Australia. Then they have to do 1 year internship. Then slowly they can go for like hospital pharmacist, consultant pharmacist. When you have a more experience, automatically you will get the promotions. Even if you have working experience in industry, pharmaceutical industry, if you are working in the industry, so you can migrate to Australia as an industrial pharmacist. So you need to work in any pharmaceutical industry, in the formulation side or quality assurance and quality control. You can work.
That's so much good news for BPharm or diplomatic or MPharm.
Yeah,
Those are eligible for this program.
yes. So basically, the bachelor degree holder, though they have minimum 4 year bachelor degree. Okay. So they are eligible
Okay.
to write this CAPS exam. They are also eligible for to apply for this industrial pharmacist. So industrial pharmacists need at least 1 year working experience. But if you do not have any working experience, still you can migrate to Australia as a pharmacist. So for pharmacists, no need to have any experience, but industrial pharmacists need at least 1 year working experience.
What about the diploma?
Yes,
Diploma pharmacist,
diploma. If someone did diploma, they also can migrate as a pharmacy technician. So
pharmacy
they,
technician.
yes, so they have to work under a supervision of a pharmacist.
That's a good. That's a big opportunity for diploma holder.
Yes.
Another thing, what is the opportunity for the diploma laboratory technologist?
Australia have basically two occupations in the list. So as you know, if you want to migrate to Australia, the Australia government make a there a list of the occupations. So your occupation must be in the list if you want to migrate to Australia. So this laboratory technician, those have did minimum 3 year bachelor degree or diploma, whatever, at least minimum 3 year. Okay.
3 years.
Then you are eligible, but someone did 2 year diploma. So they are not eligible.
After 10th or after 12th, sir?
After 12th, generally in India we have a after 12th, even Pakistan also same. So if you have experience like after 10th, so you need might be having more working experience, not just the 2 years. Basically,
That's a
I
good.
here very simple. Here is a one committee. The committee will decide based on your working experience, on your duration of your course, and what you study inside in the course. For example, there's a hematology, how many hours
Mhm.
hematology, the lectures you have done, and how many hours for the practical thing. So they have to go through your all those CVs and your even for the syllabus of your university where you study, did your diploma or degrees, a lot of things they check one by one, and then they will give, yes, you will get a positive assessment or negative assessment. If you got positive assessment, directly you can apply for visa.
Oh, that's the depend on this judicial board, I think.
Yes, yes, but those that have 3 year degree after 12, definitely they are eligible. I know a lot of, but this is like someone did after 10, 2 year or 3 years. So this is like maybe not.
But I think Gulf country is easily
Yes, yes,
eligible.
yes. Those have a 2 year. I mean, a diploma holder they can do Gulf, DHA for Dubai. They can give.
Another question, sir. What is the salary for this local pharmacist abroad?
So basically, salary is very, very high here because they paid per hour basis. It's not just like the monthly basis. For example, if you are in India, Bangladesh, in our own countries, like, they pay like monthly basis. Yes. So you have to work like 8 hour, maybe 12 hour. If you work the same salary, they will give you. But here, they give per hour basis. So you have to work basically 8 hour per day and for 5 days. So 40 hour weekly, you need to work. But if you are working additional hour, they will give you the additional salary. So I'm telling around 80,000 to 100,000 on an average salary for pharmacists. This is in Australian dollar. So if you can convert it into Bangladesh, I have no idea how much, but in Indian rupees, I
Uh,
can say like
that's a
around.
so much handsome salary for Bangladesh or I think India or Pakistan.
So in
So much
India,
handsome.
around 3 to 5 lakh per month, Indian rupees.
Sir, I want to know about Kaps exam. Is it so much difficult for passing this exam?
I can say it's very, very easy exam. If someone cannot pass this exam, I mean, I personally feel, he the pharmacy degree, maybe he cheated or something, how he passed the pharmacy degree. Because, even in my pharmacy degree, the passing marks for me 50% in my degree in India, So same here, the 50% they will see. If you score 50%, you will pass. Even there is no negative marking, so they will give you 100 questions. You just need to correct 50. If 50 correct, you will pass. So it's very, very easy exam. It's straight away.
Uh, Sir, how to easily crack this crap exam?
Basically, we are following last 15-year question papers. So we did a lot of research on those 15-year question papers, from which particular topic, how many marks they are asking, So we follow that pattern. So if any student joining academically, so we make sure he will definitely will pass the exam if we follow our own content. So we provide live session plus recorded, so he can watch second time after the lecture finish.
After the class? After the
Yes,
class?
yes, and we will also give the PDF format, the booklet for that particular book and particular chapter. We also take a lot of mock tests. So for example, there are so many systems in the body like GIT, CVS, or respiratory system. So in this system, first we will cover the theory, pathophysiology, and then what are the disease in that particular system. For example, respiratory system. Okay, so like COPD and asthma, there are so many diseases for that, and then we will discuss the management for this. And then once we cover this theory, then we will cover last 15 years questions, whatever they ask from this particular topic. Then we will discuss why it is correct answer, why these three are the wrong, you know. And then after this, once we finish this GI, this respiratory system, then we will say to student, please, now you need to go for our mock test. So if your score below 50%, then we will call that student individually. We identify why he is not performing well, where is he has a problem, so where we can improve his score basically. So we basically like make sure you definitely will pass once you join the academically.
You will provide all note on class, and you make sure that the Kaps exam will be passed those students.
Yes, even we our coaching is like until the candidate pass the exam. So whatever time take, it may take 3 months, 6 months, even 1 year. We don't charge. We only charge one time. He with we will with us until he pass the exam.
That's a good opportunity for us. Until they are not passed, you will continue this coaching or this process.
Yes,
That is
even we guide our all students like until their job, for their visa also we help them, even if there is a we have so many our student, now they are doing job, so we recommend them, please, this is our student, this and that, so we basically help whatever we can. But we are not an agency, we are not an agent, so this is a basically a ad tech company. We are our responsibility to help you to pass the exam. The additional things we are providing you, this is like, from us like free of cost.
Uh, I also know that that's
Yeah.
thing. You are a more you are a trusted company. I think you are more trusted company. Sir, I have another question for academically. What are the difficult exam for BPharm graduate to migrate foreign country?
I mean, it's up to the student, where he want to go. But at this moment, I can say Australia will be the best country to migrate, because Australian government giving the easily visa. All healthcare professionals, they are given visa very, very fast, within 2 weeks, 3 weeks, 4 weeks. But if you are an engineer, for example, it may take up to 1 year, 1.5 year to get the visa. They give the visa based on demand and supply, basically, I can say, so they have a healthcare professional have a high demand. It is called critical shortage for healthcare professionals in Australia.
Now, that is a technical shortage. That's
Yes.
why they provide visa as soon as.
Yes, as soon as possible. Yes. So
All
if
right.
you fulfill all the requirement, they will give you immediately the visa.
Sir, another thing, in the near future, can we expect it increase the number of people they are migrate the foreign country for
Basically,
career opportunity in pharmacy?
right now the Australia government basically changed. So earlier government was given around 140,000 visa. So new government already increased 50, 60,000 visa. So now currently 2 lakh visa they are given Australia government every year, permanent visa. This is like highest visa they are given. But in future, I can't the comment that they will. But this government is going to be next 3 more years, because every 4 year there will be election. So each government have their own policies, right? So they have to make accordingly. So right now I can say like a lot of people are migrating to Australia, Canada, UK. They need a lot of migrants because they need to boom their economies.
Sir, I want to another thing. How many cost in Bangladeshi Taka currency they want to move in Australia, as like exam fee, as like
So, for
sitting
example, if
exam,
you are
another.
a pharmacist, so
Yes, sir.
around you need to pay around total, including the government fees, each and everything is our fees. We provide you the assistance for skill assessment and Kaps preparation, then PT preparation, all those together. So around 7,500 AUD is total. You need to spend. I know a lot of Bangladeshi students, they are coming to study here. They are spending like 100,000 AUD, and still they are not getting the PR visa, not getting the job. I can give you the best example. I have interviewed one girl. Her name is Faria. That interview still available on my YouTube channel. So this girl is from Bangladesh. She did master degree in Bangladesh. She was working in pharmaceutical industry. Then she came. She is studying right now in one of the university in Australia. So she joined the CAPS exam. So once she passed the CAPS exam, so she can apply for PR visa, permanent visa.
That is a big opportunity for those who want to migrate foreign country. I think that's a big opportunity for those students.
Yes,
Uh,
definitely.
Another thing, can you help us for career opportunity as like healthcare professional, nurses, doctor, and another lab technician?
Yes,
How can you help to provide this support?
yes, of course. We have, for example, anyone did like medical degree, MBBS, okay? MBBS,
Yes, sir.
MD, or MS. Now they want to practice in Australia. So academically will help you to complete an A to Z process. For example, the first step, document evaluation, we will do behalf of them. You just need to provide us their document. It can copy of their document, right? Then
First of all,
we,
document. You provide
yes.
document evaluation.
Yes.
Yes,
Then they have to pass AMC exam, Australian Medical Council exam. So we will provide them 4 month coaching, online coaching from Australia, Australian lecturers. Those already passed this exam. They migrated from India to Australia. So they can, help them to pass this exam easily, and then they can come to Australia. Same for pharmacists, same for nurses. So nurse have a NCLEX exam they need to pass, and lab technician need to pass that AIMS professional exam, physiotherapist and dentist ADC exam. So any healthcare professionals, we are helping them.
that's a great opportunity. I think. Last question for you, sir. What are the exam we say academically helps to professional prepare, settle their represent this career?
So yeah, I mean, any healthcare professional basically, they are a medical doctor, nurses, pharmacists, physiotherapists, veterinary doctor, or dentist. So all the healthcare professionals, they need to write the exam in their own field. So academically will help them to complete A to Z process. So easily they can migrate from Bangladesh to Australia.
How to contract with you, sir, in academically?
Yes, so academically, our website, academically.ai, or we will also, you can give our, the website link in your description. So you can directly,
Yeah.
you can go there, and we will give you the, uh, yes, you can contact us basically anytime, or you can maybe subscribe my channel, Dr. Akram Ahmed. So I always make content basically if you are looking to migrate to Australia or any other countries. So I always make new content for healthcare professionals if you are looking to migrate. If you want to go outside from Bangladesh, Definitely, we will help you.
So thank you so much to give me expensive time. And next time I will another session with you.
Yes, sure, sure,
And
sure, sure. Thank you so much.
thank you, sir. Allah Hafiz, sir.
I think Allah Hafiz.